If you are just joining us for this final session, I'm Dr. Natasha Montpellier. I'm a practicing naturopathic doctor in Canada, as well as a lead clinical science liaison at Fullscript. I've been practicing for about 10 years, and for the last 5 years, my practice has focused mainly on women's health and specifically hormonal reproductive health. And it's probably one of my greatest pleasures and honors in clinical practice to help a patient conceive and then support them throughout their pregnancy and their postpartum period. So I'm really excited to share with you the clinical tools that we've developed to help you support your pregnant and postpartum patients. So we're going to start off with just a few housekeeping notes. So please submit your questions in the chat and I'll do my best to answer as many as I can at the end of the presentation. The webinar is being recorded and you'll have access to that webinar following the session. And then you can also access the slide deck in the file section of the webinar platform. And the last thing before we get started is that just a quick reminder that this presentation is intended solely for the education of healthcare providers and is not meant to provide medical or professional advice. Okay, so let's get started. The Society for Maternal Fetal Medicine describes pregnancy as a window to future health, and I think that is so incredible. Research shows us that pregnancy complications can impact maternal health for up to 50 years after they give birth, influencing long-term health for themselves, obviously, and then also for their offspring. And as healthcare providers, adopting a whole person care approach during that critical window is key to help prevent future health complications. And that's why we've created 4 plan templates in collaboration with Ovation Lab, one for each trimester and one for the postpartum period to support comprehensive care throughout the perinatal journey. Now, we're going to kick things off with a quick poll. So yeah, I think you can see that easily. So go ahead. We're going to post on, yes, there it is. So I'm going to read out the question and the answers, and then you can select directly on the screen which one best fits you, which description best fits you. So which of the following do you find the most challenging when supporting pregnant or postpartum patients? Is it identifying safe, evidence-based ingredients to recommend, selecting relevant labs that inform treatment, knowing which lifestyle strategies are effective, creating a personalized plan quickly, or maybe you don't treat pregnant patients and you're just here to learn more. So while I wait for you to make a selection, I'll just share personally that for me, when I was first starting out treating pregnant patients, my biggest challenge and worry was actually identifying safe evidence-based ingredients. We kind of have, especially in traditional medicine, we have a lot of our ingredients actually come from traditional medicine, but we don't always have the research to indicate whether they're effective or especially safe in pregnancy. So, and I think I am, yes, most of us, 70% safe evidence-based ingredients, and then followed by creating a plan quickly. So regardless of where you fall in that quiz, we're actually going to be addressing all those components. So evidence-based ingredients, we're going to go through labs, we're going to talk about lifestyle strategies, and then we're going to talk about the treatment plan template that can help accelerate the process so that you're not spending so much time creating your treatment plans from scratch, but also giving you lots of opportunity to personalize that treatment plan. So we're going to walk through the whole person care protocol for supporting patients in the first trimester. But as I mentioned, we did develop 4 protocols in total, one for each trimester and the postpartum period. But due to timing, we're going to do the first trimester. So I'll take you through that template. But since we're talking about templates, I would just love to gauge the audience where you are at in regards to your familiarity with Fullscript protocol templates. Are you a beginner? You've never used a template. Maybe you don't even know what it is. Maybe you're intermediate, you use them sometimes, but you're not maybe fully confident. And then we have experts using them daily in practice. So I'll just give a few moments for you to answer that. Again, you can go directly on the screen and select the best, the answer that fits you the best. And beginner and intermediate. Okay, but I see that more and more of you are becoming more intermediate users. I'm hoping that by the end of this presentation, especially those who are in that beginner category, you feel confident to at least try the first trimester template to kickstart your treatment plans. So all of these components that we're going to talk about are part of the first trimester protocol. So we're going to start off with labs. So first trimester labs establish a baseline and help you identify risks early. Early testing enables timely interventions for better pregnancy outcomes. So we have tests like the human chorionic gonadotropin hormone, so HCG, and also progesterone, which helps you confirm and date the pregnancy and also assess viability. And then once confirmed, we have a first trimester lab panel. So that typically includes a CBC, blood type, Rh factor, thyroid panel, vitamin D, and also infectious disease panel. So there's nothing necessarily out of the ordinary or maybe unique in regards to these tests, but that these are tests that are available. Next, we're going to talk about ingredients for the first trimester, especially I would say like our foundational ingredients that would apply for most of our patients. So we have our prenatal multivitamin, which technically is more like a misnomer. It's multi-ingredient or micronutrients because we have vitamins and minerals in our prenatals. So there's an association with reduced risk for small for gestational age, neural tube defects, cardiovascular and urinary tract defects, and limb deficiency in preterm birth with a mother supplementing with a prenatal multivitamin. And study shows that there are actually better outcomes with a prenatal compared to just doing folic acid supplementation or folic acid and iron supplementation. Now, there are 4 things that I actively look for when I'm recommending a prenatal for my patients. I want to make sure that there's activated folate. About 50% of the general population have the MTHFR gene variant, which prevents them from actually activating folic acid. And we know that folic acid is very important for neural development, especially neural tube formation. We also have choline. That's one that I check for as well. That's not always included in prenatal multis, and it's also not always in the dosing that we need. But I'm going to leave more information because I do have that on the third ingredient. One ingredient that may be also missing is vitamin A. So this is where you really want to know your patient's condition and their history. Are they a person that should avoid vitamin A, or should we try to look for a prenatal that contains like either the precursor beta carotene or vitamin A? So that's just something to take into consideration. And on a similar note is also iron. So iron is not necessarily appropriate for all patients, especially those who have iron overload conditions. But if you have a patient that is deficient or tends to be on the lower end of iron, then you might want to either ensure your prenatal has iron in it, or maybe do individual iron supplementation to ensure that you have the best absorption of iron, because we know that in a prenatal, we have a lot of ingredients that could probably decrease the absorption of iron. So those are some things to take in consideration. Next, we have omega-3 fatty acids, but specifically DHA. Now, DHA helps to support fetal growth. We also have longer gestation, improved birth outcomes, and also the reduced risk of preterm birth. Unfortunately, about 95% of women of childbearing age actually don't get enough omega-3s. And so it is certainly recommended that we recommend to our patients to start taking a omega-3, or you can also do a omega-3 that's higher in DHA, and recommend that they start taking that by week 20, if not earlier. And then they continue taking the DHA either until birth or until the 37th week of pregnancy, whichever comes first. Now we're circling back to the choline. So this is an ingredient that's not always included in prenatal multivitamins. So they support neural tube formation, fetal brain development, and also maternal cardiometabolic health. Similar to omega-3s and DHA and EPA, our patients aren't really meeting their daily choline needs. So about 89% of pregnant women don't meet the daily choline needs. Now, what's unfortunate is that a lot of the prenatals, if they do contain choline, are not going to be reaching that amount that we require. And then in the first trimester, it's up to 450 milligrams per day in the first trimester. So solo supplementation of choline may be needed in this case. And then the last 2 ingredients have to do with nausea and vomiting associated to pregnancy. So first up, we have vitamin B6, and this is believed to exert an antiemetic effect by acting as a coenzyme that modulates lysine reactivity, which can reduce nausea and vomiting associated by the increased levels of estrogen during pregnancy. And it also acts as a cofactor in the production of neurotransmitters like serotonin and dopamine, which can also contribute to nausea and vomiting when they are deficient. The ideal dose you're looking for is anywhere between 10 to 25 milligrams every 8 hours. The next one is ginger. So ginger is probably one of those traditional medicines that's been used for all kinds of nausea associated with indigestion, nausea associated with chemo, and it's also been found to be effective for nausea associated with pregnancy. You can also use this in conjunction with vitamin B6. The maximum dose for ginger is 1 gram per day. Ideally, you want to do that in divided doses because that might cause some pretty severe heartburn. You can do 500 milligrams twice per day or recommend 250 milligrams 4 times per day. I tend to recommend the 250 4 times per day just to make sure that there's no heartburn associated with it. And then you can also recommend that they take it with food if they are, experiencing any issues. Now, a clinical pearl for B6 and ginger is that it works best if patients are taking it preemptively, so not just taking it as needed, but taking it, for example, they have B6 could be with breakfast, lunch, and supper, and similarly with ginger. And so that is more effective than just taking it as needed. None of my patients have found it helpful when they were just taking those two ingredients, either one or the other, as needed. So definitely creating a regular schedule of taking these ingredients. And for some patients, it won't be beneficial and they may need pharmaceutical interventions. Okay, so now we're going to go into some dietary recommendations, and then in the next slide, we'll talk about some lifestyle recommendations. So we're going to start off with dietary. So we want our patients to focus on whole foods, well-balanced diet. We want to encourage them to avoid or reduce their intake of processed foods and also overconsumption. Contrary to the popular, saying or eating for two, that's not actually true. Patients in the first trimester are likely requiring around 300 additional calories. And when I, puts in Google, like, okay, what's about 300 calories in regards to a snack? That's like an apple and about 2 tablespoons of almond butter. It was close. It was a little slightly under 300 calories, but around that. So we're looking at possibly 1 to 2 additional snacks per day. And we want our patients to prioritize foods that are rich in folate, iodine, iron, vitamin D, although not many whole foods have vitamin D. A lot of fortified foods have vitamin D. And then, of course, we want to encourage as much as possible that they increase their intake of omega-3 rich foods, and that would be mainly low mercury fatty fish, and we're looking about 2 to 3 servings per day. Now, hydration is also another important part of diet. So we need fluids to increase to support our blood volume, also the amniotic fluid and also fetal circulation. And so this is about 8 to 10 glasses of water per day. So really encouraging our patients that they track and that they ensure that they keep up with their hydration. Also, dehydration can increase their risk of nausea. So that's perhaps one way to encourage them to stay hydrated during their pregnancy. And speaking of hydration, we also have caffeine. So we want to ensure that our patients are consuming no more than 200 milligrams of caffeine per day. So that's roughly about 2 cups of coffee per day, small cups. But also we might need to educate our patients, not just coffee has caffeine, black tea, green tea, chocolate, of course, energy drinks all have caffeine, so that they become aware that it's not just coffee. So if they're consuming any of those other foods, especially if chocolate in large quantities, in small quantities, kind of not necessarily, but black tea, green tea, energy drinks. And then we have some general food safety guidelines. So we want our patients to avoid unpasteurized dairy, soft cheeses, deli meats, smoked fish, raw seafood, and undercooked eggs. And that's simply because of the risk of foodborne illnesses is higher due to reduced maternal immunity. So it's not necessarily that these foods are inherently unhealthy, but it's just because of the foodborne illness risk. And then last on this list is that we have alcohol. So no amount of alcohol is safe. Very small amounts of alcohol can actually cause fetal alcohol syndrome. So we do want to counsel our patients to avoid alcohol consumption during their pregnancy. And I'll be showing you a patient handout that summarizes or gives plenty of details about all these dietary recommendations that you can give to your patients. So you can go through some of these dietary recommendations with them during the session, but then during your appointment, but then you can give this handout afterwards to support that so they have something to refer back to. Okay, so next we have exercise and stress management. So moderate intensity activity is actually linked to a lower risk of anxiety and depression, especially mid-pregnancy, C-section, excessive weight gain, gestational diabetes, preeclampsia, and also low birth weight and preterm birth. So for uncomplicated pregnancies, it's recommended 20 to 30 minutes of exercise most days, totaling into 150 minutes per week. And when it comes to stress management, it's important that we screen our patients for anxiety and depression at least one time in the first trimester. Prenatal mental health issues can occur in any trimester. It's not just in the postpartum period. And this can help guide us in regards to recommending perhaps some mindfulness-based strategies if there's a lot of stress, cognitive behavioral therapy, relaxation techniques, yoga, or even perhaps refer them to a mental health professional if they need additional support. And then our last lifestyle recommendations, we have sleep and environmental toxins. So unfortunately, many pregnant individuals sleep longer, but experience poor quality sleep, and that's due to hormonal shifts. And unfortunately, sleep disturbances are linked to adverse outcomes such as preeclampsia, gestational hypertension and diabetes, C-sections as well, preterm birth, and also stillbirth. So as best as we can, we want to recommend our patients that they sleep between 7 to 9 hours per night. And we can encourage safe, non-pharmacological strategies. That could be mindfulness practices, gentle yoga, music therapy, acupressure, sleep hygiene. If they feel kind of more agitated at night, perhaps doing exercise earlier in the day can be helpful, or even seeing a mental health professional if they're feeling they're having a lot of worry and that's keeping them up at night. So there's definitely a lot of strategies that can be employed to help with sleep. And the last thing that we'll talk about with regards to lifestyle recommendations is environmental toxins. So these are linked to pregnancy loss, preterm birth, low birth weight, and also neurodevelopmental delays. It's also advised that patients avoid, all recreational drug use, minimize exposure to all forms of smoke. So that could be tobacco, cannabis, etc. Heavy metals, so lead, mercury, cadmium. If air pollution is not something that we can necessarily control, but if there are concerns about air quality, perhaps if finances allow, a air filter could potentially be, machine can be put into the bedroom at night, or if they work from home, it could be in their office. So some things to consider there, but I know that's not possible for everyone. And then we also have endocrine disrupting chemicals. If you attended the fertility session we had earlier in the month, we talked about removing endocrine disrupting chemicals to help with fertility. Well, it's also important to continue that, or if it wasn't started already, to start that in your pregnancy to help reduce that bioaccumulation in the fetus. So we have reduced plastic use, especially heating plastics, choosing safe cosmetics and household products, using filtered water if water quality is an issue, and then if possible, opting for organic or low pesticide produce and animal products whenever that's possible. So here is the patient handout that I mentioned earlier. It's attached to the template in your account. And it's created by our medical advisory team, and it's essentially there to support the recommendations of this protocol that we've just gone through. So you can also find this in your resource section of your account, which I'll show you where you can access that. So, and if you download this presentation, you can also access it on the link on the slide. Okay, so we're just going to wrap up quickly by going through how you can find and apply the template in the Fullscript platform. So if you haven't logged into your account, please do so right now, and then you can follow step by step as we are going through. So I'll just take a sip of my water while you do that. Okay, so once you've logged in, you'll land on your home page. To access the template, you'll navigate to the left-hand menu, and you're going to click on catalog, and there's going to be a drop-down menu that appears, and you're going to select templates from that list. And then once you're in the template library, you can use a search bar to find a specific template by using some keywords. You can also filter by owner, so whether it's created by Fullscript or perhaps you created that template yourself. So we're going to actually select on the first trimester protocol template. The fourth trimester, if you're in your account, you might see that it's not there. It is currently being uploaded, so it will be available shortly. So once you click on the template, you're going to be brought to the preview page, and this is where you'll find a list of the tests that we discussed. as well as the products that are associated to the ingredients that we discussed as well. And then you'll see the patient resources at the bottom. Now, switching to the evidence tab, you can explore all the ingredients and the lifestyle recommendations. Included in the protocol, you'll find the dosing recommendations and also the supporting research for each ingredient and lifestyle recommendation. Now, here on the slide, it's just a condensed view, but if you're in your account, you'll see a very, extensive list of all the research that we have supporting these ingredients. And then when you click Build a Plan, you'll enter the plan writing tool, and this is where you can customize the protocol template. So I was saying earlier, you can use these templates to kickstart your treatment plan. Doesn't necessarily mean that we're doing a one-size-fits-all for our patients. So you can use this template as a starting point. But what you'll see when you get into the plan writing tool, at the top, you'll see a list of tests. You can remove those tests. You can add tests because of some specific conditions you want to assess in your patient. Below that, you'll find the products featured in the template. And again, you have full control here. You can remove the products, you can adjust the dosages, you can add notes, and you can even introduce new products that weren't originally included. And at the bottom, you'll find the patient resource, such as handouts. And then you can also remove that handout if you want to, and you can add your own resources to the treatment plan as well. So the flexibility really allows you to tailor the plan to your patient's unique needs, while reinforcing health literacy and behavioral change. And this can really help accelerate how quickly you turn over personalized, customized patient plans. And then once the plan is finalized, your patient will receive a notification. If they have a Fullscript mobile app, the plan will be easily accessible and it will be directly available on their device. And from there, they can select the products that they would like to purchase and they can add them to My Currently Taking. It's a section in the app which acts as a supplement tracker, essentially. And patients can use the auto refill so that they can choose to put products in auto refill so they never run out of their products. So they're always on track with their plan. So these features, along with the dosing reminders, can really help your patients remain adherent to their long-term wellness, especially where patients are going to be at least on these products for 9 months. So that is the walkthrough. I know that we are at time, so I'll see if I can answer maybe 1 or 2 questions, and then that will be the end of our session. Okay, so first question, is there an adverse effect if the mom is taking more than 800 milligrams of omega-3s? So not necessarily. The dose of omega-3s, total EPA, DHA, we're looking about 1 gram per day. But something to keep in mind is that omega-3s do thin the blood. So they're blood thinners, which is one of the reasons why they're helpful for cardiovascular disease. So that could be something to keep in mind in case your patient has any bleeding disorders. So that's a possibility. And I'll answer one more. Okay, so I have one here. Any suggestions for a safe, natural solution to pregnancy acid reflux? That is a challenging one, to be sure. So slippery elm is a herb that you can use. It is a demulcent, so it acts similar to DGL, if you're familiar with DGL. Unfortunately, DGL is not recommended during pregnancy, but slippery elm, basically it's usually in a powder form. You can mix that in some hot water and drink it as a tea. And that can be helpful to just coat the throat and the stomach to help mitigate some of the issues of reflux. Just like any demulcents, you don't want to be using slippery elm at the same time as supplements because it could reduce the absorption. But that is something that you can consider for your patients who are experiencing some reflux. All right, so we are definitely over time, but thank you so much for attending this session. And if you do have questions you want me to answer, I believe we have on the next slide. Let me just go on over here. So if you have any questions about your account, you can email support@fullscript.com. And if there's any questions about this presentation, the content, you can email me at education@fullscript.com. And thank you again so much for attending.